What's up, you guys? My name is Miguel, fellow Xray Tech here, giving you your daily dose of radiation. In today's video, we are covering what to expect when you're working overnight or your system goes down, goes offline, goes on update, you have network issues, all the above. I work night shift. We deal with this stuff constantly. That's why we get paid a little bit more money than anyone else. Day shift usually doesn't. The system usually runs pretty good during the day, but sometimes stuff will, update or go down, or they'll have something going on. So essentially, depending on what system is down, if it's the PAC system, that's where we actually do all the manipulation on the imaging and we have the archive of all the X-rays. Usually if that one's down, you're gonna have to shoot it on the portable machine, pull up to the doctor and be like, hey, take a look at it, because I can't put it online, you can't see it. Same thing, it won't get read by the radiologist unless you push it manually, and you have to deal with that. That's kind of the gist of the system. You'll have to work with the same thing if you go on the floor. You're gonna have to get a doctor or someone to look at it, because they won't be able to see it because the system's down. Now, if the other system that the rest of the hospital uses, that's where you get your orders and other stuff like that. There's different systems, different names. I'm not going to sit here and name them all, but that system, if that one is down, then you're going to have to go to usually the paper or the verbal order, or you'll have to manually enter the stuff onto the PAC system to be able to generate an order and then link it up later. Tedious, but it can be done. Or you just quick start, same thing, and you'll just show those. If you manually enter it, it'll show up on the PAC system, and then the doctors can usually pull it up and you can probably send it off. Now you have to be careful. Certain machines, and I've noticed at my hospital, you can push images when the system's down. Certain machines, if they didn't get update or they don't have the thing, can't push images onto your PACs or onto your things. So you have to be careful. There's been a few times that we've noticed it at my place that certain machines can't do that. And we brought it up to the attention of our manager, and they just need a system update, but you have to be careful. Because the worst thing that can happen is the system's down and you shoot something and there's no way the doctor can see it. Majority of the times when the system goes down, I shoot everything portable, and then I just pull up to the doctor and be like, hey, look at it. And then be like, okay. Now, obviously, if you work on CAT scan and do something else, that's a little bit different. This is a whole different world over there, because there's no mobile stuff. So, which, once again, once all the system goes back online, certain places everything will link up. Other times you'll have to manually link up everything. You have to manually put in the orders. The doctor will have to order everything, and you'll just be playing the catch-up game and then get everything read and go back to normal. Now, depending on which version you have, if it's the PACs going down or the whole system, that the order, it can change significantly the work pace. If it's the whole system, usually all the hospital knows what's going on, because that's what they mainly use to order stuff. Nurses doing their stuff, they know. But if it's the PAC system, usually the whole emergency room or the hospital doesn't know what's going on. So you, as the fellow photographer, got to tell them, be like, hey, system's gonna go down, this is what's gonna happen, or else you will get bombarded by calls by everyone like, hey, I can't see my stuff, and you have to repeat yourself over and over and over, even though they send out emails, but most people don't look at their emails, especially when it comes to our department. So yeah, if you work night shift, you will deal with that way more. I would say once a month, bare minimum, you'll have to deal with some level of that going on. Updates, stuff going offline, stuff like that. That's something you have to deal with, and it's something you'll have to learn to work around. So once you know it, you'll be able, that's you'll be good. You'll be able to handle and navigate the situation, and you'll be able to work accordingly and get your own system, and you'll be good. So yeah, it's been your boy Miguel. See you on the next.